Eating disorders. There are several types of eating disorders, each with their own set of symptoms, causes, and treatment options. The three most commonly recognized eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Here's an overview of each one. Anorexia nervosa. Anorexia is characterized by a severe restriction of food intake, an intense fear of gaining weight, and a distorted body image. People with anorexia may see themselves as overweight, even when they are dangerously underweight. Symptoms may include dramatic weight loss, preoccupation with food, calories, and weight, obsessive exercise routines, refusal to eat certain foods or entire food groups, intense fear of gaining weight, withdrawal from social activities, depression or anxiety. Treatment for anorexia often involves a combination of therapy and medical care. Inpatient treatment is sometimes necessary to help individuals regain weight and stabilize their health. Cognitive behavioral therapy, CBT, and family-based therapy, FBT, are both effective forms of therapy for treating anorexia. Medications such as antidepressants and antipsychotics may also be prescribed to manage symptoms. Bulimia nervosa. Bulimia involves a cycle of binge eating followed by purging, vomiting, laxative abuse, or excessive exercise. People with bulimia may feel a lack of control over their eating and may eat large amounts of food in a short period of time, even if they are not hungry. Symptoms may include binge eating followed by purging, preoccupation with food, calories, and weight, obsessive exercise routines, use of laxatives or diuretics, hiding food or wrappers, withdrawal from social activities, depression or anxiety. Treatment for bulimia often involves a combination of therapy and medical care. CBT and FBT are both effective forms of therapy for treating bulimia. Medications such as antidepressants and antipsychotics may also be prescribed to manage symptoms. Binge eating disorder is when you eat so much that you can't stop. This is usually followed by feelings of guilt, shame, and distress. Unlike bulimia, people with binge eating disorder do not purge after binging. Symptoms may include episodes of uncontrollable eating, eating when not hungry, eating until uncomfortably full, eating alone due to shame or embarrassment, feelings of guilt or disgust after eating, depression or anxiety. Treatment for binge eating disorder often involves a combination of therapy and medical care. CBT and interpersonal therapy, IPT, are both effective forms of therapy for treating binge eating disorder. Medications such as antidepressants and anticonvulsants may also be prescribed to manage symptoms. In addition to these three eating disorders, there are other eating disorders that are less common but still serious. These include avoidant, restrictive food intake disorder, ARFID. ARFID involves an extreme pickiness with food or avoidance of certain foods due to sensory issues or fear of negative consequences such as choking or vomiting. Orthorexia. Orthorexia involves an obsession with healthy eating to the point where it interferes with daily life and causes anxiety or distress. Other specified feeding or eating disorder, OSFED. OSFED involves disordered eating behaviors that do not meet the diagnostic criteria for other eating disorders. Depending on the person's symptoms and needs, these disorders may be treated in a way that is similar to how anorexia, bulimia, and binge eating disorder are treated. In general, treatment often involves a combination of therapy, medications, and other forms of medical care as needed. Here are some examples of therapies and medications that may be used in the treatment of eating disorders. Therapies. Cognitive behavioral therapy, CBT. CBT is a form of talk therapy that focuses on changing negative thought patterns and behaviors. In the context of eating disorders, CBT can help individuals identify and challenge negative thoughts related to food, weight, and body image. Family-based therapy, FBT. FBT is a form of therapy that involves the whole family in the treatment process. This approach can be particularly effective for treating anorexia nervosa in adolescents. Interpersonal therapy, IPT. IPT is a form of talk therapy that focuses on improving interpersonal relationships and communication skills. In the context of eating disorders, IPT can help individuals address underlying emotional issues that may be contributing to their disordered eating behaviors. Dialectical behavior therapy, DBT. DBT is a form of therapy that focuses on teaching skills for regulating emotions and managing distress. This approach can be particularly effective for individuals who struggle with binge eating or purging behaviors. Medications. Antidepressants. Antidepressants such as selective serotonin reuptake inhibitors, SSRIs, or tricyclic antidepressants, TCAs, may be prescribed to manage symptoms of depression or anxiety that often accompany eating disorders. Antipsychotics. Antipsychotic medications may be prescribed to manage symptoms of psychosis or severe anxiety that may occur in some individuals with eating disorders. Mood stabilizers. Mood stabilizers such as lithium or anticonvulsants may be prescribed to manage symptoms of bipolar disorder that may occur in some individuals with eating disorders. Appetite stimulants. Appetite stimulants such as cyproheptadine may be prescribed to help individuals with anorexia nervosa regain weight and improve their overall health. It's important to note that treatment for eating disorders is highly individualized and may involve a combination of different therapies and medications depending on the specific needs of the individual. Treatment may also involve collaboration with a team of healthcare providers, including a primary care physician, psychiatrist, and nutritionist, among others. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition.